Hello, my name's Robert McConville. I'm a family doctor in Sanford. I've been practicing here since 1981, and I've seen a lot of patients in that period of time. I wanted to talk to Mr. McMILLIAN asked me to talk today about a subject that I thought was interesting, and I want to talk about diabetes, type 1 diabetes, where patients have an inability to produce insulin from their pancreas, and so all those patients are on insulin. And then there's type 2 diabetes, which is the most common type of diabetes, which we see in the United States and all over the world. I can remember 10 or 20 years ago it occurred in about 5% of the population. Now 10% of the population in the United States has type 2 diabetes. It happens due to also a lack of insulin, but also an insensitivity to insulin, so that the cells in your body don't respond to the insulin like they used to. And the way we diagnose diabetes is by an elevated blood sugar. If your blood sugar is above 126 before you eat, or above 180 2 hours after you eat, you're diabetic. We also use a hemoglobin A1C test, which is a blood test that measures the amount of sugar attached to the red blood cell. And if that level is above 6.5 or above, that means you're diabetic. Of course, you need to have it repeated at least twice, and/or the blood sugar be repeated at least twice to confirm that you're diabetic, because you can sometimes have an error in testing. So that's how you diagnose diabetes. The symptoms usually of diabetes are frequent urination, increased thirst, sometimes weight loss, increased appetite. The reason people lose weight when they're diabetics is usually when their sugar is high, they tend to urinate off a lot of that extra sugar, and they're losing calories from their body, so they're losing weight. I probably see about 1 out of every 4 or 5 patients I see every day has diabetes. So I see probably more patients with diabetes than I see anything else. Most of them can be treated with diet, which is the mainstay of treatment. Diet is the most important thing. It's very important that when you're diagnosed with diabetes that you see a dietitian and find out what you should and shouldn't be eating. If you try to do it on your own and just manage it with medication, more often than not, it's not effective. The medications work very well, but they have to be coupled with a diet. I can't emphasize how important diet is. If you think about a plate that you would eat at a lunch or supper, most of us eat a lot of starch because it tastes good, or we drink something sweet or eat something sweet. For a diabetic, a quarter of that plate could be starches, which would be corn or rice or bread or potatoes or other kind of beans. Half the plate would be green vegetables, and a quarter of the plate would be meats. That's the main. That's called the plate method, where you determine the amount of starch you eat in your diet, because starch converts to sugar in the body, in the bloodstream, and it'll raise your glucose. We measure glucose in the blood. Sucrose is sugar. Fructose is what's in fruit, and glucose is what we measure. When you get IV intravenous fluids, you get dextrose. So there are lots of different oses, which are sugars that are put into our body, and they all get converted to glucose in our body, which is what we measure. Now there are oral medications, which I'm sure a lot of you have heard of, like metformin and glipizide and Actos, and there's insulin. There are long-acting insulins and short-acting insulins. There are also the newer medications that have come out that are very expensive, as we all know, that especially the patients who have to take them, like Jardiance and Farxiga, which are called SGLT2 inhibitors. They inhibit the body's ability to reabsorb sugar, so you urinate off all that sugar, and that lowers your blood sugar. And then there's medicines called Ozempic and Mounjaro, which are called GLP-1 agonists, and they stimulate the pancreas to produce more insulin, and they tell your brain that you're not as hungry as you think you are, and they also delay emptying of the stomach, which makes you fill up faster. That's why they also work to help you lose weight in the form of Wegovy and Zepbound. We usually monitor the diabetes by checking sugars on a daily basis. If you're not on insulin, you only need to check it once a day. And your fasting blood sugar ideally should be below 130, and your 2-hour after eating blood sugar ideally below 180. If you're on insulin, we usually measure it 3 times a day or more, and usually measure it, your doctor will tell you when, but usually before meals and or at bedtime. And the same thing applies. You'd like the sugars to be below 130 before you eat and below 180 2 hours after eating. Some people like it stricter, 110 before eating, 140 2 hours after eating, but that's tough to get to that level. You have to work hard and you have to be on a very good diet to do that. We also, as you know, some of you know, have what were called continuous glucose monitors, which monitor the glucose minute by minute. And you can actually have an app on your cell phone. You can put your cell phone up next to the monitor, which is on the back of your arm, and get an instant blood sugar and tell where you are, which is a nice thing to have, especially if you're on insulin and you're adjusting your dose of insulin, taking a little bit more if your sugar's high or a little bit less if your sugar's low. It'll help warn you when your sugar gets too low and help you to know if the dose of medicine you're on is not working. Some people who have severe diabetes, type 1 diabetes, which I mentioned, which is where you don't produce insulin, are on insulin pumps. I do not manage insulin pumps. Those are kind of complicated. Endocrinologists do that, diabetic specialists. And there are diabetic specialists in Pinehurst. I believe there's maybe one in Sanford. They're in Cary, Raleigh, Chapel Hill, a lot of different places where you can go to have that type of diabetes managed. Unfortunately, diabetes doesn't exist by itself. There are a lot of things that can happen with diabetics. Most diabetics have problems with their cholesterol or triglyceride, more often triglyceride, and they often have to be on cholesterol-lowering medications and triglyceride-lowering medications. Triglyceride is fat in the blood. And also, high blood pressure is more common in diabetics, and that needs to be managed with blood pressure medications. Certain blood pressure medications are better for diabetics than others. Diabetics can develop mild, moderate to severe kidney disease where they spill protein where the kidneys leak protein and or the kidney function decreases. And that can be treated with some of the medications that I've talked about, like Farxiga and Jardiance and ACE inhibitors and ARB inhibitors like losartan and lisinopril. And diabetics also are increased risk of heart disease. So it's very important that their cholesterol is managed. They're on the good diet, low-fat diet, usually aspirin if it's reached a certain age, maybe 50, or if they have any history of heart disease or stroke. Stroke is also an increased risk, and heart failure. So all those things need to be monitored in a diabetic. Kidney function, protein in the urine, blood sugars, hemoglobin A1Cs, cholesterol, etc. So being diabetic it's a complicated disease, but it can be managed and you can live a healthy lifestyle if you follow the rules. Like I said, diet is very important. Exercise is also important. And keeping an eye on your blood sugars and seeing your doctor on a regular basis. That's what I wanted to go over today and talk about diabetes and how I approach it, some of the medicines that are used and some of the diseases that are associated with diabetes. And my name is Robert McConville. I practice at Central Carolina Sandhills Family Care, which is next to the hospital. It's part of the LifePoint Hospital network. And I practice with Dr. Caldwell and Dr. Parker McConville, my son, and we have several nurse practitioners or PAs who practice with us also. Sherry Falk, Kylie Caldwell, and several others, Kaz Marcy, Mrs. Ward. Those are the people that I practice with every day. Thank you very much.